हेलो व्यूअर्स, अभी हम लोग लैक्राइमल apparatus के बारे में जानेंगे. Components of lacrimal apparatus. These are components of lacrimal apparatus. This is lacrimal gland. These are lacrimal duct. This one is conjunctival sac in between the palpebral and its orbital part, conjunctival sac. Then lacrimal punctum, lacrimal canaliculus, this one, lacrimal sac, and nasolacrimal duct. And abbreviation of all this, lacrimal is common, so gland, duct, conjunctiva, so con, lacrimal punctum. This punctum means opening, just like vacuole. So B, canaliculus C, sac S, nasolacrimal duct. Here again duct is repeated, so nasolacrimal N. So mnemonic to memorize all the components is God congratulate vaccine. Please give rest to your lacrimal gland. Don't cry. So Lord Ganesha congratulate vaccine. Okay, God congratulate vaccine. So vaccine will save us, so don't cry. This is God, GD, congratulate vaccine, VCSN, vaccine. Now coming to first component, lacrimal gland. It is of two types, main gland and accessory gland. Main lacrimal gland. This one is main lacrimal gland. It is J-shaped, a serous gland, that is, it has got watery secretion. Exocrine gland because it contains duct, and tubuloacinar variety. Lies within the lacrimal fossa of the frontal bone, situated on the anterolateral aspect of the orbit. Here lies nose, so this is lateral aspect, the anterolateral aspect of the orbit. Okay, it has got two part, orbital part and palpebral part. Orbital part is deep part, lies deeply situated, and it is superficial. Orbital part, it lies above the levator palpebrae superioris muscle. Here this is levator palpebrae superioris muscle which indent lacrimal gland, and palpebral part is superficial and it is below the levator palpebrae superioris. Okay, and its action, main lacrimal gland, just like Malik, owner, it fulfill a special need that it does reflex lacrimation due to any infection, foreign body or emotion. Okay, and accessory lacrimal gland. This is main lacrimal and this is sagittal section, and here like these are the accessory lacrimal gland. Also here these are accessory lacrimal gland and this is main lacrimal gland. Accessory lacrimal gland is of two types, Krause, gland of Krause, and gland of Wolfring. Accessory, so it is regarded as knocker. So कैसा knocker? K for Krause and K for कर्जदार knocker. ये कर्जदार knocker है. And this is wolf. Wolf means लोमड़ी, सियार. वुल्फरिंग, ये धूर्त नौकर है. ठीक है, तो ग्लैंड ऑफ क्रॉसे लाइन superior fornix. This is superior fornix and this is inferior fornix. This is superior fornix, lies in the superior fornix, and gland of Wolfring Dhurtnocker lies near the, this one is Krause and this is Wolfring, above Krause, or also here. Okay, superior as well as in the inferior fornix, this is, and near about the this palpebral fissure in the palpebral border of the tarsal plate, this is Wolfring. and this again, this one is pull free, and above one superior fornix as well as in the inferior fornix. This is gland of Croze. Second component is the lacrimal duct. Each lacrimal gland, either main or accessory, has many ducts opens into the conjunctival sac. What we are seeing here, these are the lacrimal duct. Lacrimal duct of orbital part or main lacrimal gland traverse across the substance of palpebral part. This opens directly into the conjunctival sac, but main lacrimal gland, the orbital part of the main lacrimal gland, it traverses the substance of the palpebral part of the main lacrimal gland. Okay. Coming to third component, that is the conjunctival sac. This is conjunctival sac. This whole is the conjunctival sac. Conjunctiva is what? It covers the cornea part, sclera, choroid, retina. There are three layers of the eyeball. So sclera, anterior 1/6 of sclera is known as cornea, and cornea is covered by conjunctiva. So conjunctiva, which covers the eyeball, so orbital, that is the orbital conjunctiva, and where it covers the inner aspect of the eyelid is the palpebral, and in between these two, this is conjunctival sac, which is a open sac. So it is an open sac in between the palpebral conjunctiva and bulbar conjunctiva. Secretion of lacrimal gland forms a tear film spread over the medial canthus to the lateral canthus. This is towards the nose, this is the medial canthus, and this is lateral canthus, and blinking causes movement of lacrimal secretion from lateral to medial side. 70% of lacrimal secretion evaporates, and rest give nutrition, moisten and drain through the lacrimal punctum. Okay, so how we can memorize? This tear film has got three layers. Ohm, and this ohm is oily layer, aqueous layer and the mucus layer, and they are secreted by three glands. Malang, MLG, Malang. Both ohm and Malang are synonym of Lord Shiva. Pure heart brings tear in eyes, and Satyam Shivam Sundaram. Satya ही शिव है, शिव ही सुंदर है. Pure heart brings tear in eyes. So, Om, that is oily layer, aqueous layer and mucus layer. Oily layer is secreted by meibomian gland, aqueous layer by the lacrimal gland, and mucus layer by the goblet cell. Okay. These are the tear film from external to internal aspect. This is oily layer, then watery, that is aqueous, and mucus. Now coming to fourth component, that is the lacrimal punctum. These opening, these are superior and the inferior lacrimal punctum allow tear to enter into the lacrimal canaliculi, this duct. Lacrimal canaliculi, it has got short part, this B component, short part, and C is a long part. Short part is 2 mm and long part is 10 mm, and both long part unite to form a common canaliculus. This short part and long part, they are perpendicular to each other. Both long part unite to form common canaliculi, which opens into the lacrimal sac. This is lacrimal sac, and here lies one valve. This is a mucosal fold, which is known as valve of Rosenmuller. Another component, lacrimal sac, it lies within the lacrimal groove. This is our lacrimal sac, lies within the lacrimal groove formed by the frontal process of maxilla and lacrimal gland. Lacrimal bone. Anteriorly, frontal process of maxilla, and posteriorly, lacrimal bone. Lacrimal sac superficially bounded by medial palpebral ligament. This is medial palpebral ligament, this one. So, superficial to it is the medial palpebral ligament, and deep to is the lacrimal part of the orbicularis oculi muscle. Here lies the lacrimal part of orbicularis oculi and it is deep to it. Lacrimal sac. It has got three parts: fundus, body and neck. And its whole length is 12 to 15 millimeter. Above the level of superior punctum. Only this much part is the fundus. And below the inferior punctum is the neck, and in between these two there is body. Neck opens into the nasolacrimal duct. Nasolacrimal duct. Here is the neck, and this opens into the nasolacrimal duct. Only this much is nasolacrimal duct. It is again 12 to 15 millimeter in length. Name itself says that it connects nose with the lacrimal sac. Nasolacrimal. Okay. Now it opens into the anterior part of the inferior meatus of the nose, and it is guarded by valve of Hassner. Okay. Valve of Hassner. Nasolacrimal duct moves downward, backward and laterally. This relation is very important, always asked in the Viva exam, that what is the direction of nasolacrimal duct? It is downward, backward and laterally. DBL, double. Nasolacrimal duct. The abbreviation of this is NLD, nasolacrimal and duct. Nalanda. Our joy becomes double, DBL, double. That is the downward, backward and laterally, because it's a matter of joy that we belong to Vimspapuri Nalanda, and our joy become double. So how we can relate NLD with the DBL? ये हंसने की बात है, और यहाँ पे जो valve है, this is Hassner. ये हंसने की बात है, the matter of joy. Now coming to the arterial supply. Lacrimal branch of the ophthalmic artery. Internal carotid, it gives rise to ophthalmic artery, and ophthalmic artery give rise lacrimal branch which supply lacrimal gland. Here lies lacrimal gland, and this one is lacrimal artery, this one, and this is the ophthalmic artery which coming out from the internal carotid. Okay, this one is internal carotid. And sensory supplies the lacrimal branch of the trigeminal nerve. Sympathetic or vasomotor. It is by the deep petrosal nerve coming from the superior cervical ganglia along the internal carotid artery. Coming to the parasympathetic or secretomotor. Main. This is the main nerve supply. This is the communicating branch to the lacrimal nerve. Branch of the zygomaticotemporal. Here we can see this is lacrimal gland, and this secretomotor fiber, it starts with the pons from the lacrimatory nucleus. It runs with the sensory root of the facial nerve, that is also known as nervus intermedius, and here it reaches up to the geniculate ganglion. This is geniculate ganglion, and now it is known as greater superficial petrosal nerve, and it runs along the here it reaches in the middle cranial fossa and known as greater petrosal nerve. Now it enters into the pterygoid canal along with the deep petrosal nerve, that is the sympathetic branch, and now known as nerve of pterygoid canal. Then reaches pterygopalatine ganglion, which give rise to zygomatic nerve, and one of the branches, the zygomatic nerve, is zygomaticotemporal nerve. This one is zygomaticotemporal nerve, and there is one communicating branch which reaches up to the lacrimal gland. So communicating branch to the lacrimal nerve, branch of zygomatic nerve, is the secretomotor fiber. Thank you.